Hello, everyone. Just bear with us. We're letting everybody come on screen. I think we're almost there. Welcome. Thank you for taking time this evening. I know this time of day, it is the witching hour for parents and kids and your activities and our teens. We're so happy you have joined us. I see some familiar names on here. So really excited to see some of your faces. So we are really excited for a great night and discussion. And I am honored that we have our newest pediatric GI psychologist with us tonight, Dr. Meg WIthington. She is brand new to our team, but not new to the university. And we just could not be, we're like exuberating excitement. I'm going to be cool, but it's really amazing. And so Dr. WIthington is with us. She graduated with her doctorate in clinical child psychology. I want to tell you a little bit about her from DePaul. And she is currently just finishing her pediatric psychology fellowship here at University of Chicago. And as I announced, she just recently accepted a position to be part of our pediatric GI psychology team. And we're just so excited. It's going to be a great addition to our team and your care and our patients' care. During her fellowship, Dr. WIthington did provide ongoing treatment, therapeutic support to patients from our teens to young adults in not only gastroenterology, but also hematology and oncology, endocrinology, and our inpatient and outpatient clinics. So we are just so excited to learn from you today. And then what's great, I want to go over a few housekeeping, is that while Dr. WIthington is going, and we're going to call her Meg soon, is going to present for a short period of time, this really is for you. Please utilize the Q&A function at the bottom of your screen. Send questions. We do appreciate those who sent in questions before. I promise I have them. And so what will happen is that we will address in our Q&A, that'll be the majority of this time. So this time is for you. If you want to talk about a situation that's frustrating or anything that you face that you would love advice and insight on, we are here to talk about it. We're excited. I am so excited to introduce our awesome team here at the Celiac Center who are with us tonight. I want to thank Lindsay Yakel, who put this amazing night together. Thank you, Lindsay, who is our educational coordinator. Dr. Verma, you guys all know Dr. Verma. She is not only our chief of pediatric gastroenterology here at Comer Children's, but she is our medical director here at the Celiac Center, and we could not do anything without her. So we're so happy she is here. Audrey Rowan is here. She is one of our pediatric dietitians. We're so happy to have you tonight as well. And Lori Wellstead is another one of our dietitians with our adult group who is here and such an important part of our team. But I have some of our teens here. I see familiar faces who have been part of our group, our InTransit group, and we're just so happy to have you. And I'm really excited to get this discussion going. So Dr. Verma, before we pass it off to Dr. WIthington, do you have anything else that I might have forgotten?
No, I just say welcome. And this is for the teens. This is for the tweens. This is for all of you. So join in. Let's make this an interactive discussion. Meg will talk some, but let's have a discussion. Let's learn from each other and don't be shy. So you guys can go on camera. You can do whatever, but let's make this for you and not for me or for Meg or for Rachel or for Lindsay. So let's go. Dr. WIthington,
Yes, thank you.
Well, thank you for that lovely introduction. I'm really excited to be here tonight and to talk to you all just about some social, emotional impacts of celiac disease that I'm sure you're all familiar with, but then also talk about some interventions and strategies that you could use to help yourself kind of feel better when you're kind of dealing and coping with this diagnosis. So let me just start my slides. All right, are we good? Okay, great. There we go. Okay. So, if you've ever experienced challenges with celiac, I just wanted to say that you're not alone, right? This is a really hard experience to manage and to deal with on a regular basis. And it would make sense that you're feeling hard. Maybe you're feeling that this is hard, you're feeling overwhelmed. So some of the things that might be really challenging for you would be managing your diet and managing any setbacks that come along with changing your diet. Maybe you're really missing foods that you used to eat, and just craving foods that you used to eat too. Maybe you're kind of tired of explaining to other people about your diagnosis, and just feeling really fatigued about having to constantly explain yourself to others all the time. Maybe you're trying really hard to avoid gluten exposures and it's just not going the way that you want it to. That can be a really trying experience. Maybe you're feeling like there are a lot of social limitations. Maybe you're feeling like you can't be as spontaneous as you used to spend time with your friends in the way that you did before you were diagnosed with celiac. Maybe you're just feeling like things aren't as enjoyable as they used to be when you are spending time with your friends, because maybe they're eating things that you can't eat, or going places that you can't eat things there. And then also just navigating school, whether it be the lunchroom or maybe you're just not feeling so great that day. Maybe you're really tired or you're having a lot of brain fog or fatigue. And so navigating all of this is just really challenging. And so I just wanted to say, if you are feeling like this is hard, you're not alone. And that's a very normal experience. And it makes sense because there's a lot to deal with on a regular basis. And so I like this graphic. I know it's overwhelming and it is an overwhelming picture, but I think it might be a really good tool. I don't know if anybody's seen it. Maybe you can raise your hand if you have seen it before. But it can be a really good tool if you're talking with somebody and they're just not really understanding how overwhelming this is, how much time and effort and energy it goes into managing all of the food choices, exposures, and the burden of having a gluten-free diet. And so these are just some of the psychosocial impacts that you might be experiencing on a regular basis. And I don't think that this list is exhaustive. I think that maybe there's probably a lot more here. But I just wanted to kind of highlight some of the things that you all might be experiencing on a regular basis and just know that this is normal. So perhaps you're feeling really different or really isolated from your friends. This can be in a lot of different environments. Maybe you're at school and you're feeling really different than others or isolated, or you're at a party and everybody's kind of enjoying something that you can't really enjoy. Maybe you're thinking about the future and thinking about going to college and you're anticipating, oh, I wonder how I'm going to navigate this, or I wonder if there's going to be anybody else in my dorm or in any of my classes that have celiac. And so it might cause you to feel somewhat alone and lonely. When I work with kids who have celiac or teenagers who have celiac or, really sort of any GI related disorder, I do hear a lot of anxiety in the things that they experience. And it makes a lot of sense. Again, maybe you're really worried about a gluten exposure. Maybe you're trying your best and your hardest to control a lot of different things and it could still happen, or you're worried that it might still happen. Maybe you're having a lot of anxiety around explaining your needs or explaining your diagnosis or disease to somebody else. And it's just socially just feels uncomfortable. You don't know what to say. You don't know how to say it. You don't know how to phrase it. And that can cause us to maybe want to avoid those experiences or feel really worried about somebody asking you too many questions. Maybe you're anxious about advocating for your needs. So maybe you're at a restaurant and you have to ask the waiter, like, what can I eat on this menu? And asking that can be really anxiety provoking for some people. Maybe you're not feeling well in class and you're just kind of figuring out how you can kind of like sneak out the back door, right? Maybe you're feeling worried or feeling like a burden or feeling anxious about how this might impact your family or your relationships with your friends. And again, these are all normal experiences and thoughts and feelings that a lot of teenagers and people who have celiac have. Maybe you're feeling new things, right? Like feelings of helplessness. When you get this diagnosis, maybe you're really struggling, like you kind of have to make a quick change and that can be really overwhelming and maybe you don't know where to start. Maybe it's even just figuring out, what am I feeling right now? How do I identify that feeling? What is this? Or maybe it's learning how to cope and manage with new thoughts that you've never had before. Maybe they're really negative thoughts. Maybe they're scary thoughts. So that can feel really overwhelming. And then I think, something that does happen with people who have celiac, because one of the, symptoms is brain fog, fatigue, poor concentration. That can be really, really distressing and frustrating, especially if you're really used to being able to focus really well. And then also just thinking about all of the things that you have to change on a regular basis can become very distracting and overwhelming, just leading to feeling shut down or scared, maybe not being able to concentrate, just feeling scattered and disorganized. I would love to see, to hear if anybody has any thoughts about this graphic, or wants to add anything, because I think that this isn't necessarily an exhaustive list. So I'm thinking, is there something else that maybe the author could have added to this picture?
Feel free to put your thoughts if you want to add anything in the chat, you guys, of what you think maybe is missing from this, something you might face or think about.
Mm-hmm.
I'm muted. I don't see anything yet. It's okay.
Okay. We can
Yes.
always come back to this. Oh,
Yes.
did you say something?
There's confused if my
Yes.
upset is due to getting gluten or something else.
I'm so glad you said that. I think that
Mhm.
that's such an important thing and probably can be very consuming, right? Because our stomach can hurt for many different reasons. Maybe you're worried about something that has nothing to do with celiac, or maybe it is because you had cross-contamination or ate something that you didn't realize had gluten in it. So of course, like that can be very confusing and distracting.
We have another one that says traveling is especially
Yeah.
difficult.
Mm-hmm. Yes, figuring out like, I'm out in the road or even just around town, right? I'm out in the road. What if I get hungry? Like, where am I going to get my snack from? Like, what am I going to do if I get hungry? Or feeling like you can't travel because you're just not sure what's going to be available to you. So that really limits your opportunity to maybe do things that you wanted to do.
Another one said finding doctors and medical care in more rural areas, which we hear a lot.
Mm-hmm. Yeah. Yes. Definitely a problem.
Somebody said that they're oftentimes pegged for being a picky eater when they actually just can't eat things from the menu.
Yeah. So, kind of dealing with and working through some of that stigma or that judgment, or just trying to find somebody, a doctor or a provider in your area who can like validate what you're going through. Yeah, these are all really important additions to this graphic. I think the traveling piece is definitely missing from this, from what I can tell. Yeah, just worrying about cross-contamination, right? So maybe you're doing everything right and nothing that you've eaten has gluten on it on the label, but maybe it touched something else.
Negotiating relationships, that is definitely, that's complicated.
Yeah, right. Like, where can we both go to eat that we both feel satisfied?
The list goes on and on.
Yeah. Oh, I'm so happy that you're all engaging with this graphic. I found it to be really insightful when I was looking at it. And I do hope that you all can use this as a way to just kind of explain to your friends or family members, like, this is what I think about every single day. Like, it really affects every aspect of my life. Yeah, that spontaneity is definitely missing. Right. Well, thank you all for sharing so much in the chat. I really appreciate your insight and your feedback on that. So, unfortunately, we do live in a glutinous world. And as much as we want to control all of the environments that we were in any given time, whether it be school, home, going to a restaurant, driving down the street, and you still see so many things that have gluten in it. You see signs from McDonald's, Starbucks, Dunkin' Donuts, maybe there are other family members in your house who don't have celiac. And so there are other things in the house that maybe you can't eat, or that, you don't want to eat because you don't want to upset your stomach. It's just not possible to have total control over all of our environments. And it might be really tempting to try and do that, but it's just not sustainable. And even when we do it, we're inevitably going to find a time where it doesn't happen. And then we end up getting really disappointed in ourselves, or really frustrated or sad. And it leads to a lot more negative thoughts, right? I also just want to acknowledge that you all are probably expending a lot more energy than a lot of your peers are to make these decisions on a regular basis. Because there isn't that spontaneity. And I'm so glad that somebody pointed that out. I was thinking that too, that spontaneity is no longer there. And so what I want to ask you all, and what I want you to think about, is maybe how can you protect yourself and some of that energy that you're expending, and put it toward things that you can help yourself live the life that you want to live despite having celiac. And so one of these things that came up in the graphic is just kind of feelings identification. And I just want to say that feelings are not bad, of course. They're really just data points for us to use when we're feeling maybe a little bit confused or frustrated or whatever. And sometimes we think that we might be able to save that energy that we're expending by just avoiding a thought, or deciding, I don't need to think about this right now. This doesn't matter. So maybe we're anxious about, having a cross-contamination. And we're like, well, that's silly. I shouldn't be worried about that because what I'm eating doesn't have any gluten in it. And sometimes that can be helpful, right? But sometimes it's not helpful. Sometimes it's more helpful to think, okay, I'm really worried right now, and acknowledging that feeling, and then acknowledging that feeling to help you move forward. I'm really worried right now, and I have read the label on this food, and I know that there is no gluten in this. So it's okay for me to eat this. Or perhaps there's a mix of emotions that are going on. Your friends have decided that they all want to go to a pizza place, and there's no gluten-free pizza there. And so you're kind of torn between feeling something on the angry scale and maybe something on like the happy scale. You're really excited and feeling thankful to have such wonderful friends who want to include you in going somewhere to eat, but you're also kind of annoyed because you can't really eat very much there. And so acknowledging both of those feelings and using the feelings identification wheel, whatever you want to call this, can be a helpful way to, again, save some of that energy, figure out what you're feeling, and then decide what's the priority. And so maybe in that moment, the priority is, well, I really like spending time with my friends, so I'm going to do that, and I'm going to find something there that I can eat, whether that be soda, chips, a salad, something that that's going to keep you present with your friends while also engaging in the activity that they're engaging in. But you can also still be angry at the same time. You don't need to leave that at the door. But I'm just saying, I just think acknowledging those feelings can be really helpful. And I love, they call this the feelings wheel, but feelings identification. There's lots of these examples on the internet. You can Google it. There's, this isn't the best one out there per se, but I think it's a good one. It's one that I use often with my patients. And I just like that there are so many different options. You can kind of start in the middle and really work your way out to really, really pinpoint what exactly you're feeling, so then you can move forward. Another thing that I like to use with my patients who are feeling anxious or worried, scared, this also works with other emotions too, is a grounding technique. When we're feeling really worried or fearful or concerned about something, oftentimes what's happening is that our brain is moving really quickly. So maybe we're on step 1 of a task or step 1 of a process or whatever. And like physically we're on step 1, but our minds are all the way on step 10. So we have crossed over so many steps, and now we're expecting the worst. Like, oh my gosh, like my mom's going to bring home pizza for dinner tonight, and she's going to force me to eat something that I don't want to eat because I can't eat the pizza that everybody else is eating. That hasn't happened yet. And so in order for us to kind of get back to reality and get back into the moment and figure out what's actually happening around us, we can use this strategy. It's called 5-4-3-2-1 grounding. I am curious if anybody has heard of this before. It's a popular one, but it's a great one. And what it does, it just kind of allows you to focus on your breathing while also just seeing what's actually around you in the moment. And so you're using your senses to kind of, again, ground yourself in reality. So what you can do, and you can do this in any order, is you're using the 5 senses and you're going through 5, 4, 3, 2, 1 counting. So you're going to look in your environment and you're going to find 5 things that you can see. You're going to find 4 things that you can touch. Find 3 things that you can hear, 2 things that you can smell, and then 1 thing that you can taste. And I encourage you to really focus on your breathing during this activity. And I also like to encourage the people that I work with to give a lot of descriptions, particularly to the things that you can see and that you can touch, because it just really gets you grounded in the moment and outside of back into step 1 and away from step 10. So you can really see what's happening and kind of be present throughout the moments. I also just want to talk about ways that we can reduce negative feelings. Now, some of these strategies are specific to celiac. Others are just more general. But the first thing that I always recommend to people is just do things that you like to do. And I know that might sound really silly and really obvious, but when we're feeling really sad and really bad and really negative and just kind of blah, it can feel really hard to do things that you know you love and can do easily when you're in a better mood. So for example, if you love to read or if you love to go for walks and you're just having a hard time, maybe you just pick up a book. You don't even need to open it. Maybe you just pick the book up, do things slowly. Maybe you just walk outside really quickly and see, it's nice out. Like maybe I'll go for a walk around the block. So just kind of slowly working your way up to doing things that you love to do, even when it feels really hard. 9 times out of 10, people do feel a lot better at the end of that activity. Finding somebody to talk to is always a great strategy to reduce negative feelings. Writing down 3 things that you're grateful for can also help your brain readjust, especially if you're having a lot of negative feelings about like, I hate celiac, like, why is this happening to me? You know, it's important to not ignore those thoughts, but it can also be really helpful and productive to restructure our thoughts around things that we love and are appreciative of. Perhaps you're feeling really frustrated that everybody at school is like, what's celiac? Like, what is this? And so creating an elevator pitch or like a 1 or 2 liner that you have in your back pocket that you've practiced that you can just pull out when you need to. You don't need to think about it. You're not expending a lot of energy. Just say it to that person and then you can move forward. Some other things that you can do to kind of get ahead of things, so to speak, is preemptively finding restaurants or bakeries or other places that you know that you've been to that you can go and have gluten-free options. I think things have become easier in the last couple of years. I mean, certainly there's like a lot more room for improvement, but it is a lot easier to find places that do have gluten-free options. So if you know that there's a place that you love to go to, that's a great one to write down and just recommend to your friends. Or maybe it means staying at your place and inviting your friends over and finding a creative gluten-free meal or snack that you can make for your friends and family and just kind of prove to you, hey, them like eating gluten-free isn't all that bad. You know, it's not my favorite, but I can find things that taste good that are also gluten-free. And then focusing on things outside of food when you're spending time with your friends. Maybe you are at a place where you're all eating, maybe you're at lunch, or maybe you're out for dinner or something like that. But focusing on the conversation, the time that you're spending with friends can kind of reduce some of those negative feelings that you might have around missing out on the things that they're eating that maybe you can't. And of course, I want to just identify some signs that we might want to pay more attention to, and you might need more help than just using some of these strategies. Maybe you're having a lot of difficulty accepting your diagnosis, or maybe you're really not able to cope or make decisions, or you're making decisions that are really impacting your ability to stay on a gluten-free diet. I understand that sometimes we might feel rebellious and we're going to like, oh, I'll just have a piece of pizza and see what happens. And I think that is something that maybe kids do experiment with, but if that's happening to you constantly and you feel like you can't help yourself from making those decisions or making different decisions, it's a time to ask for help. Maybe you're noticing that you aren't spending as much time with your friends as you used to, or that you're really not wanting to go to school, or that you're noticing that there's a change in your schoolwork. Maybe you're getting lower grades than you're used to. Those are times that you want to maybe seek help above and beyond your parents and your family or people at school. Maybe your worry is getting so difficult to control that you're not able to sleep very well, or that it's really distracting that you just feel like you cannot focus on anything else. That's also a sign. And then maybe you're using unhealthy coping skills. Maybe you're using substances. Maybe you're restrictive eating, above and beyond, like keeping a gluten-free diet. Maybe you're also having concerns about your own safety, keeping yourself safe, maybe wanting to hurt yourself. Those are, of course, concerns and things that you might want to ask, that you should ask your parents or your family members or your caregivers for more help. And so my final slide is just thinking about what can a psychologist do for somebody with celiac disease, because that might be a question that you're all having. And I am biased, but I think that a psychologist can be an excellent addition to support your medical team. And I am a pediatric psychologist. I do have a special interest in GI-related disorders. And what I have done with my patients in the past is just support them in advocating for their needs with their medical providers or outside of the medical provider system, at school, at home, problem-solving adherence, figuring out how to keep a gluten-free diet, reducing anxiety, improving mood, are all things that I have worked on many times with patients on those areas. And it's important because anxiety and depression are unfortunately more likely to occur in adolescents with chronic illnesses. And celiac is no different. There's so much burden placed upon you to make these decisions. And so I just want to let you all know that we're here to help you and support you and provide you good coping skills and resources and tools to help you feel like you can live the life that you want to live despite having celiac. And again, I just want to thank you all for giving me this opportunity to talk with you and share my slides. And I'm happy to answer any questions you have. There's my email address. If you do want to send me an email and ask me questions outside of this talk, I'm happy to engage in a conversation with you.
Well, thank you, Meg. That was awesome. Thank you. Thank you. I really am looking for that interaction from the chat. I was thinking about this, Meg, as you were talking, that I have some questions. And so I want to encourage people, please utilize that Q&A. But even in the chat, if people want to, on a positive spin, what's your elevator pitch, guys? Like, how do you go about talking to friends or coaches or your sports teams, talk about celiac, or and just that 2-minute elevator pitch, I like to say, where you kind of have your full talk. Does anyone have any tips, or they want to even go off mute and share, especially our teens? We'd love to hear from you. And what is your pitch before we go into some of these questions? If anyone wants to be brave and volunteer, or I could call on someone. And I think some of you know who I'll call on. I see some of the people that we know. Does anyone want to get on and bravely just say kind of how do they share or what their pitch kind of looks like to people? Anyone? Oh, Anya, I see your hand.
So is the question just kind of like what the 2-minute pitch is to like let people know you have celiac? Okay. So yeah, I usually just start by saying to people kind of that I have celiac, which is similar to I always tend to compare it to a gluten allergy because sometimes celiac is difficult for people to understand, which is obviously there's a difference, but allergies tends to click a little better. And then I explain that I'm really sensitive and I can't have any cross-contamination or anything like that, which makes it super important that everything kind of is very separate for me. And I'll usually just ask if we're going out to eat or something, if I can have like some sort of involvement in where we're going to eat, what we're going to eat, and that sort of thing.
That's great. Does anyone else want to share something, how they kind of introduce themselves or describe celiac disease? Any tips? Well, you can think about it while we move on, because I do have some questions and I'd love Dr. Verma and Dr. WIthington to be able to address some of these. And I know in the chat, we even had some questions as well. But this is Dr. WIthington. I'm going to start with you. What are some strategies that will help with feelings of resentment toward yourself or shame that have to do with this? I know you went over some, and I love the grounding method. Is there anything else that you would recommend just, you know, for teens and kind of what you see in the office when
Yeah.
you're caring for patients?
Yeah, let me think about that for a second because that is such an interesting question to think about. Resentment that you have toward yourself. That's such a strong feeling. Um, Certainly, I would recommend maybe seeking help outside of your family because I think that that is something that would be challenging to work through alone. But doing some of the things that I recommended in terms of reducing negative feelings. So engaging with a friend, doing things that you love to do, spending time with other people, being kind to yourself too. Self-talk can be a really powerful tool. And so perhaps, finding some phrases and words that you can say to yourself that feel good and sound like you can be a good resource to kind of combat some of that resentment that you're feeling. But I would recommend maybe reaching out to a therapist and also asking them for a couple of sessions for how to manage that feeling, because that sounds really strong and really powerful.
I agree. Dr. Verma, I'm going to shift this question to you. One question that came in is just feeling nervous about going to college and all that comes with it. And I was thinking about this, and I know that we, talk about this through our InTransit program. Do you have tips for people to kind of information, I think, is power. So what would you say to someone who comes, into your office and is approaching that time where they're thinking about schools and feeling really nervous? What would you say?
It depends on when the child is actually diagnosed with the condition. I think if you've just been diagnosed, it takes a bigger effort to get over this nervousness because you've just been, had 15, 16 years of your life freedom where you can go wherever, whenever, and eat whatever, whenever. And now you have not only a life-changing event as far as going to college, and then on top of that, you have these food restrictions or those kind of things. So I think I would say one of the most important things is to validate to the child and the family. It's not just to the child, but and to the family that this is an overwhelming event that's going to happen. Even without having the food stuff, just going to college is overwhelming for everyone. So I think it's important to acknowledge that. It really becomes very important to say it in those words that I totally understand that this is overwhelming. However, this is, literally you don't have a choice. So if we don't have a choice, then these are the people who can help you. And I think it's important to establish that team. The team becomes important then, so that you then have a team that supports the parents and you have a team that supports the child. And I think if you can support the two groups, then eventually the synergy occurs and they support each other. And the team that you need to lean on is your medical team. And the medical team includes the clinician, whether it's a physician or nurse practitioner or whoever, the dietitian, the education specialist, the psychologist. I mean, that's the team you have to lean on and not feel like I'm burdening the team with that. There are so many times I have to tell my patients, if I'm making a phone call somewhere, you're not burdening me. This is my job to actually get you where you are. If there was a medication, it would be my job to work with insurances to get you that medication. So this is my job. And it's very important for the family to feel that you are not putting a burden on me. We're doing this together. So that's the patient that has just been diagnosed not long ago. Now, someone who's been diagnosed for a long time, like Anya, then Anya takes charge because she has been educated. So that becomes important, that us as the clinical team have to make sure that we've educated the families when the child is diagnosed, when they're 5, 6, 7, 8, whatever, in terms of what that condition is. But acknowledgement becomes, in my opinion, the most important thing, and not to say, oh, well, no big deal. It is a big deal. It is a big deal, and acknowledging it is a big deal. But at the same time, we have a team that is going to help you and that's going to support you. And it's important that you come back to us if we haven't supported you enough. And, the shame part of it that you asked, I think that often there is a lot of guilt where the child, especially the teen, the tween, they feel that impact that their condition has brought to the family. That impact is there. There's a financial impact, there's a social impact, there's a medical impact. So it becomes important. Again, the education piece is really important. The education for the family and for the child is important. And those feelings are not going to go away unless everybody as a unit works together and says, this is life, right? This is life. This happened, not because it's your mom or your dad or your grandparents' fault. It's the way it is. And we all need to work together to move to the next step. So long answer, but I really want people to understand that we have to acknowledge this is not an easy thing to deal with. However, we have teams to help you. And that is important. And it's important for the parents to understand as well that for that child, it's not easy. And for the child to understand that it's not easy for the parents either. But we all work together. I mean, that's why we have this forum here, that we need to work together to go to the next step.
Mm-hmm. That's a great answer. Dr. WIthington, do you have anything to add to that? Specific to college, maybe.
No, I love the education piece and just being part of a team. Not only are you part of a team with your medical providers, but you're also a team with your family too. And realizing that everybody plays a role and has a lot to adjust to. And so, yeah, no, I think that was very well said, Dr. Verma. Yes.
Thank you. It's years of feeling this passion for this group. So important, very important that we all work together. And I'd love to hear more from our teens and tweens. Ask your questions, whatever it is. This is your forum. If you want to get off and just talk about it, you don't want to type, that's fine. Whatever way you want to put it in, talk about your feelings. You have the person here, your expert right here, who will help you with that.
Yeah, absolutely. We can give it a minute. I would say, as we're talking, I love that this group pulls from all over the country. It's kind of amazing. And we do recognize that we are very spoiled here at the University of Chicago that we have a team approach with our dietitian and Dr. Verma and our team, like Lindsay and I, and also even having Dr. WIthington. It's really important. And I know there's some speaking, on the chat about just like access to care. And we're happy to connect offline about those because we do recognize, there aren't celiac centers everywhere. And that we try to offer so much virtual education for this reason, so that we can provide a lot of education across the country. So I really do appreciate these comments. And I know how important it is for your families to feel supported and have access to different teams. For our teens out there, is there any topic you want to talk about? I might go back up. How do you deal with the added stress on your family that this causes? So Dr. WIthington, I think this is more like a broader approach of, the child is asking, how do you deal with the added stress on your family that having celiac causes?
Yeah, just like Dr. Verma mentioned before, there can be a lot of guilt and a lot of anxiety and worry about what this means for families to manage, because it isn't just a child, it is a family disease, and you're all coping with it. So I would say to the tween is definitely talk with your parents and ask them questions and have an open conversation with them about, what's going on or what they can offer to you to help support you. And, again, I think I'm going to go back to some of the strategies that I recommended is just, doing things that you love to do. And remember that, your parents care about you and that they want to support you in the best way possible. And so remembering that is their primary goal and that they want to do their best by you.
And I think I would ask the tween, what do you think is the stress on your family? Because sometimes I believe that putting things in words is one of the things that adds to it. Are you concerned about the family as far as eating together? Are you concerned about the family going out? Are you concerned about the financial? What is your concern? Let's put it in words. And then let's analyze that one step at a time. And I think, having the family sit together, sometimes it's a good thing and sometimes it's not a good thing. So maybe sitting and having that discussion in your clinician's office, that might be something, or even the parent reaching out ahead of time to the gastroenterologist, for example, or the psychologist and saying, this is a concern at home. So let's put it in words. What is it that the child thinks is stressful for the family? And it could be as simple as, I'm concerned because my parent is always worried. Well, let's talk about to the parent and say, what are you worried about? And let's try and break it up piece by piece, because I think the strategy that you had, Meg, as far as the anxiety, I need to try it out. So I'll need that slide so I know the breathing and maybe we should do that exercise here while we are here, because you went over that pretty quickly. I'm like, I need that slide for my own sanity as well. But I think sometimes just putting it down, that my stressor is my parent is worried about me or whatever, then breaking it down might be helpful for that. That's what I would suggest. But again, our answers may not help everyone. So then it's important that each individual talk to their team and see how they can actually break it down a little bit. But talking really does help.
So it seems like, when I was looking through the chat, and I keep encouraging you guys, put your questions in the Q&A, eating out seems to be a stress. It's a stressful point of view. And so I guess my question is twofold. One, how do you deal with the anxiety or anticipation, Dr. Withington, about eating out? And then secondly, I'm going to turn it over to Dr. Verma to address specific strategies, right, that we talk about at the center. And I mean, Lindsay and I could even tell you guys some of the things we talk about doing, but I want to first address it's the anticipation, the anxiety of just eating out and that process. And so, Dr. Withington, can you talk a little bit about that?
Yeah. So, I think what Dr. Verma just said about kind of acknowledging, like, what are the concerns? What is the anxiety? What are you anticipating is going to happen? And making that really clear for yourself can be a good tool and a strategy to then tackle that fear, that worry. Again, we cannot control every environment that we're in, and we can still attempt to enjoy going out to eat by finding places that maybe do have gluten-free options, or have at least something on the menu that that your child can hopefully enjoy. I think it's very challenging depending on where you live, to find places that do have enough gluten-free options to be enticing. But I think managing the anxiety ahead of time by spelling it out and then doing some of those deep breathing strategies, relaxation strategies, also having a plan B. Maybe you do go to a restaurant and thinking that there's going to be an option for you there, and then you realize there isn't. Maybe you have another option or another restaurant as a backup. Maybe you go home and enjoy something at home because you know that that's going to be something that's going to, meet your need. But reducing the anxiety could be planning ahead, having a plan B, and really acknowledging what that anxiety is before you go out.
That's great. And Dr. Verma, I know some of the strategies we talk about is, I like the planning ahead, and that includes even calling the restaurant, talking to the restaurant ahead of time and calling it off peak hours to see, asking your important questions of knowing if they know how to handle having someone, what are your gluten-free options, but even how they prepare their food. If you can talk to the chef. Dr. Verma, do you want to go through any of those, even just, seeking out that information to give you a little bit of power, I think, of your going out?
I think, you know, one of the first things that people need to realize when you get diagnosed with celiac disease is that spontaneity is gone. So I think once you can absorb that I'm not just going to be able to pick up my bag and walk out and say, I'm going to this restaurant, unless you've been there before. But even then, things can change. So if we can acknowledge as people with celiac disease that I cannot be as spontaneous as I used to be before I got diagnosed, it makes it a little bit easier in the sense that, okay, you know what, this is how life is going to be. And I don't like it. I absolutely don't like it, but I cannot just walk out. And I think the gluten-free app is a fantastic one to have on your phone. But again, be careful. There are many restaurants that are now on that gluten-free app that might have closed. So again, disappointment can happen where you think I'm going to drive 5 miles from here and find the restaurant and it's gone. So call ahead, make sure the restaurant is still there. And then you would still call when you get there, ask the same questions. But before I answer what I tell my patients, what I'd love to hear, are there any teenagers or tweens who want to tell me, what do you do when you have to go out to eat? Somebody, come on. Guys are not usually this shy. It's a psychologist who's making them shy. Come on, somebody, one person, what happens if you want to go out to eat? Anya, got your camera on. You're on. Let's go.
Sorry, I stepped away for 1 second. What's the question?
You're not listening? Okay. So the question is, what do you do when you have to, what preparations in your mind you're going to go out to eat? What do you have to do? Jude also has a hand up. Okay, Anya, I'm going to put you on pause. Jude,
Okay.
go ahead. Tell us, what do you do? Cannot hear you.
Anya, we lost you.
No, it was
Oh,
Anya is there. Jude, I couldn't hear.
Jude, we can't hear you. Oh, Jude's there. Hi, Jude.
I could not hear. Okay, while Jude is getting the vocals on, Anya, what do you do when you have to, how do you prepare yourself to go out to eat?
I think the first thing is before I get there, I like to do my research ahead of time. I think it's a really difficult feeling knowing when you walk into a restaurant and hearing from them that they don't have any gluten-free options, stuff like that. I think that's, for me at least, was a really tough feeling to cope with. So I found that if I call ahead, I do my research, I'll use the Find Me GF app, but then I'll do confirmation by checking, seeing that they have good reviews. I'll call the restaurant myself, see if they're like gluten-free, ask my like standard questions. Do you have a separate fryer? Is there any cross-contamination? Is there shared equipment? Those sorts of questions, I'll do it before I go. And then also just kind of being mentally ready to have that conversation, have those questions. Sometimes it's hard, it's draining. It's the same questions over and over again, explaining it. It's just a frustrating process. So before I go out to eat, I think mentally just reminding myself, like, I know how to do this. I'm prepared. I'm equipped. And I also need to sometimes remind myself that if I don't think a place is safe, there's no point taking the risk. And it's just kind of those mental checklist reminders, stuff like that, I would say, that are really helpful for me.
Okay, thank you. Jude, ready to talk?
Is it working?
Yes, perfect.
All right. Basically, what Ananya just said, basically everything.
So let's say there's a restaurant that has opened up close to home and everyone's talking about it. Walk us through, so somebody else who may be on the talk today and they haven't done this before, walk us through what you would do or your family would do. A restaurant has opened up. Anya has opened up a new restaurant and everyone's talking about it and you want to go there. What would you do?
Well, I would ask the waiter if there's any gluten-free options because I want to make sure I'm safe.
Mhm.
And then if there is, I would ask if they could clean their stovetops or stuff so
Mhm.
I could be more safe.
Excellent, excellent. I think asking those questions, and of course, you can, and I'm sure you do that, not necessarily say, you would say gluten and then, talk about wheat because that's what they understand more than anything else, though a lot of places will understand gluten now. So asking those questions, fantastic. And you said you would ask. I love that you would be asking that. That is great because you've taken charge of your condition and you are keeping yourself safe. One other step that you could potentially have done is maybe a few days before you actually go to the restaurant, you could call, or at that time, a parent could help you with that, is to call ahead and say, can I talk to the chef or can I talk to someone who's in the kitchen? And you would do that a few days ahead of that. And it's at a time that it's not that busy, so middle of the day kind of thing. And be able to ask them. Now, sometimes restaurants get overwhelmed with those questions. So you could just say, I would like to eat a chicken dish or something. How would you prepare that? So you can ask them to walk you through the steps in terms of the chicken is there. Are they on the same grill as something else? You can educate them as well so that the next time someone else has to go who has celiac disease, the restaurant will know as well. So calling ahead a few days prior to that, the disappointment that Anya was talking about, that you don't want the disappointment when you walk there, you're hungry, and they say, we don't have anything gluten-free, then you get hangry, right? So asking a couple days ahead of that in a new place. If you've already been to this restaurant before, you would still ask the same question. So if you're ordering something with chicken or meat, how is it prepared? Is it on the same grill as something that's breaded or not? And if they say yes, don't give up. Say, can you make this in a pan so that it would be for you, that you could have a pan, and then what condiments they use and so on. If they have gluten-free pasta, there's a question, a very important question that you have to ask. Do they boil that gluten-free pasta in the same water that they boil the regular pasta in? If they say yes, then you say, can you possibly, when I come there, can you make the pasta, the gluten-free pasta, boil it in water that does not have, that you're not boiling the same? So some detailed questions, but it's sometimes helpful for the chef and the restaurant if you actually pick out a meal and say, this is the meal I would like, can you make it or not? And if you cannot, why not? Let's see how we can actually do it. And again, try and call when it's not that busy. But then again, when you go there, you ask the same questions. And that is the frustration and the anxiety about going out, because you have to keep asking the same questions over and over and over again. And you hope that this would stop. Unless the restaurant is totally 100% gluten-free, to keep yourself safe, you have to ask those questions. But it doesn't mean that you should stop going out to restaurants that are not completely gluten-free. Just have to do a little bit extra homework at that time and still be able to go there, right? Rachel, does that help answer your question?
That totally does. And Dr. Withington, before we end, I was just hoping you could give some insight into navigating relationships. I know that came up earlier on the chat in a few different places. And I know we talked about its impact on families. But how about friendships? How do you navigate friendships where, maybe you don't feel supported, or some of the things our teens face, of just having to make decisions about food and everything, but how do you navigate relationships?
Yeah, and that can be certainly really tricky. I think one thing that Dr. Verma did bring up earlier was the education piece. And it's sometimes, it's not always your responsibility as somebody with celiac to educate other people who don't have celiac 100% of the time, but it can be helpful to maybe give them that graphic or give your friends more information just to really understand, this is how I'm feeling. This is what this feels like when you say this to me, or when you make decisions about going to a restaurant that I just know I can't eat there. So giving them that information and that education about how you're feeling, what's going on in your mind, and just like what the experience is like for you, because it might be that they just really don't understand. So giving them the benefit of the doubt can be a really good tool and strategy to use to navigate relationships with friends. And, you know, I can understand how if you have a partner or a friend who doesn't have celiac or doesn't need to, you know, can eat gluten safely, you know, it can cause a lot of conflict at times, particularly if they want to enjoy something and they want to enjoy it with you. But I think having that conversation and being really open and open-minded, and maybe thinking about creative ways that you can make a meal that you both can enjoy together, can be kind of a fun process potentially, right? Like it's using that creativity and that problem solving together to make it enjoyable for both of you. But I think education and communication are really just the two most important things when you're navigating friendships and relationships with people who don't have celiac.
That's great. Thank you. Dr. Verma, do you have any closing thoughts to that?
I think I'm going to take off from this last comment about how it's difficult for families to navigate the discussion about calling ahead and so on. I totally agree with you that this is not an easy thing to do. However, what I would say is depends on the restaurant as well. If you have one of those mom and pop restaurants, in my experience at least, and I have 2 children who have celiac disease, I found that they are much easier to work with. And bringing the food along, at that point, I think you need to have a discussion with your teen or tween. How embarrassed are they going to be if you bring the food along? So it becomes important for us. And I can give you personal examples of my own self, how I've embarrassed my children. And that sometimes when we used to go out to eat together, they would say, Mom, you're going to be quiet. So I think it's important for us as parents to listen to our children. If they don't want to have you carry a bag of food into a restaurant, have them eat the meal and then go to the restaurant and maybe then just have ice cream that's gluten-free or something. But having that conversation with your child becomes important, which again, I learned through the tough ways with my kids saying, don't embarrass us when we go into this restaurant now. So having that discussion, and I agree with you that if you're not comfortable with a restaurant, don't go there, go to another one. And I do see a hand up. Now, I don't know if it's Stacy or if it's, the name says Stacy on the box. So, but go ahead, your question.
So how do you handle if your child's friends or friend's family wants to have you over for dinner? How do you even figure out, is it even safe? Or do you end up having to decline and then invite them over to your home?
I think that they are different. It depends on the friend and their household and what the education that they have in terms of gluten-free options. So one option, and I'd love to hear what the teens, at least the 2 who've been talking, would like to say, but one option is to say, yes, we'll come over and we'll bring, depending on how many in your family have celiac disease, but bringing over a gluten-free option for the person who has celiac disease. Or if they want to do everything, giving them examples of maybe a frozen food that they could have, or eat your meal at home and say, we'll come for dessert or something, so that's one option. If you can have that understanding with the family, they know about cross-contamination, which gets to be very overwhelming if you have celiac disease. But the best I would say is not to necessarily decline, but say, we'll bring something as well, and they can have, and you can bring the stuff for whatever the person who has celiac disease likes. And then this way you're not socializing, because again, our social life shouldn't always be determined by food, which unfortunately it is, but it shouldn't. But I would say bringing something over, then you are not worried and upset, and you can still have a good meal is probably the easiest thing to do rather than spend 2 hours educating someone else. But that would be my suggestion. But all depends on what your relationship is with the friends, family, and so on. But maybe if Jude, you're still on, tell us, what would you suggest happens in this situation? What do you think, Jude?
I don't know. Is Jude frozen?
No, it's maybe Anya, what would you do?
I would say my go-to thing is it's just really dependent on the situation and on the family, I would say. There's some families where either siblings, aunts, uncles, there's like people who in their family, if they have someone with celiac, they tend to be a little bit more aware and educated on exactly how cross-contamination works and that sort of thing. In general, I'll say that like, oh, just let me know what you guys are going to be preparing. I'll bring the same thing that's safe for me. Don't worry about the food for me. I'll come and bring it. That tends to be the safest, easiest option. I like kind of how the chat was kind of talking about. Personally, I'm not always comfortable with how things have been prepared if I'm not there to like see kind of how it's being done myself. One thing I found is some families will do like prepackaged like pineapples or like cantaloupe and stuff like that that'll come straight out of the pack, so I don't have to worry about like contaminated knives or anything like that. Those tend to be super safe. If they're open right in front of you, you know that there's no cross contamination. That's super helpful. But I also say it definitely depends on the family. I went out to one of my friend's house. I just met her this year. Just found out that I had celiac, and I told them to not worry about food or anything. But her mom knew of this like small bakery that was completely gluten free. She had the person who baked it write a whole letter that there was completely safe of cross contamination. It like showed all like the different ways it was prepared. She's like, there's was nothing that remotely has gluten in there. And me being a little bit extra, I called ahead, made sure. And yeah, I think it definitely depends on the family. And in general, though, I'll say bringing your own food tends to be the better option.
Yeah. And I know, Dr. Verma, I was thinking about this because we've done some other segments in the past that um not just like a side dish, like you can say, great, Jude's favorite food is, if you don't mind, I'll bring a main something hearty enough that your child will eat, or they'll go and they'll eat, serve yourself first, so that it's safe. But I think there are definitely options. I want to transition really quick because we're talking about schools here, colleges, and I know that for our teens, it's definitely something you face. And I could be really, Dr. Verma, correct me if I'm wrong. Would, this is what I would do. I would care less about a safe list of colleges for dining, because I would work with where you want to go to school. And when you're visiting that school, meet with the disability office, the dietitian. You can meet while you're touring a school, you can actually meet with the kitchen, uh, you know, and talk about dining options and at the schools that you're really interested in. Because I think that every school, we're here also as a resource. Lindsay is wonderful at this, and Dr. Verma and our dietitians, like, will work with you and the actual college to help ensure that you have safe options and everything. But I wouldn't limit to just colleges that are known for being safe. I think you can go to college and there are options for you. Dr. Verma, did I say that wrong? But
Oh, no, I'm a firm believer. Everyone knows that. You pick a college because you want to go there, not because of the food. The rest is up to your team. You got to help to get that food in there. College should be a college experience. It should be what your child wants to do, and the rest will fall in place.
so
Some places it'll be harder than others, but
Yeah.
some places. I just want to make a comment about the kids going to another kid's home to eat.
Yeah.
I think, again, it becomes very important to sit down and chat with your children. What is it? You don't want them to be confined just sitting at home. You want them to be safe, but you don't want them to be the person who doesn't go anywhere. You don't want them, then the socialization doesn't happen, the friends don't happen, and everything becomes a big deal. So, talking to the kids, having them, they can take their own food or eat food and then go. They can take a bag of Lay's potato chips with them. And, that's good enough because the kids don't care. The kids want to go and socialize with their friends and they want to be with their friends. And they can eat before they go. They can take candy bar with them. They can take chips with them and have a good time. One of the things I do suggest when I'm seeing patients in the office is that if there is a particular 2 or 3 friends that the kids are always, going over, then what I suggest is keep a frozen meal in that in that child's freezer. So if your child has 2 friends that they're always hanging out at each other's homes, just keep a frozen mac and cheese. And all that they can do is if your child is there and it's dinner time or whatever time, take that mac and cheese and put it in the microwave. And it's done. And your kid will be happy. You may not be happy because he or she only ate mac and cheese, but the socialization, the growth, that is a key and that is important. I'm not a psychologist. I'm sure Meg will tell you that that is more important than eating that balanced meal at that time. If it's chips and whatever, fine. But let them be happy with that. So in those homes, if it's 1 or 2 homes that you hang out with often, keep a frozen mac and cheese, keep a frozen pizza, something in there, and they can pop it into the oven and be done.
That's great.
That's what I would suggest.
Yes. And I want to close this out with Dr. WIthington. Do you have any final thoughts? We have had some great questions and discussions, just some takeaways that you want people to walk away from tonight with.
Yeah, I think just know that whatever you're feeling around your diagnosis, you're probably not alone, and it is not unreasonable to feel the feelings that you're feeling. I think that's the biggest thing. Your feelings are real and they're valid. And then this is a really, really hard thing to navigate. There's a lot of decision making going on, and you're all doing amazing. You're doing the best that you can do with the tools and the resources that you have in front of you. And this seems like a really great group and a really good team that you have at your fingertips who's available to help support you in navigating how to function the way that you want to function while also having celiac.
Well, thank you. I know we didn't get to every question, but we are already 10 minutes over our program, and this was amazing. Thank you, Dr. WIthington. I think this is a really important topic, and we hope for our teens, we're trying new things. Let us know what you want to talk about and hear about, and we're excited to have another talk this spring coming for you guys, but we are just so appreciative of everyone here, and just lean on your teams. And there are tons of resources. We have an InTransit guidebook online, and we're happy to send in follow-up, and that tries to address a lot of these topics. And I want to let everyone know that this program is being recorded. So Dr. WIthington's slides will be up on that YouTube recording. So you can rewatch if there was a certain thing that she was speaking to or a slide you really loved. Definitely capture that. And I think that starting with your, gastroenterologist, your pediatrician, build your network to find a pediatric dietitian that hopefully works with your gastroenterologist if you're not, in an area that has that. But it's really building resources around you within your schools, social workers. There's a lot of people that can support you and your child as you navigate this. So we are, we're really appreciative of everybody attending tonight, and we will definitely be in touch with more future programming. But thank you, Dr. WIthington. We really appreciate it. We're so excited that you will be
Thank you very
with
much.
us.
Yeah.
Awesome. Thank you all.